Hello everyone, my name is Dr. Kanchi Vyas and I'm an MSc in Advancing Physiotherapy Practice in UK. Before we start, I would like to thank PhyX Pain Solutions by Dr. Nitin Kumar Arora for giving me this opportunity to share my knowledge with you all. So my topic for today is virtual reality in preoperative anxiety and pain. Now it might sound like one of those technical sessions, but I assure you that most of this is related to physiotherapy. Now, this might ring a bell for some of you by thinking about it as the head-mounted display. Allow me to explain further. And don't worry, even if you don't know much about virtual reality, I'm sure by the end of today's sessions, at least you'll have a basic idea about virtual reality. So today we'll be talking about what is virtual reality, what are the types of virtual reality, covering VR and physiotherapy in brief, what is preoperative anxiety and the importance of managing it, and then we'll be combining the use of virtual reality in preoperative anxiety and pain. And towards the end of the session, we'll be talking about the contraindications and the precautions for VR. Now, due to recent advancements in the technologies, there have been so many emerging technologies in the field of healthcare. And one such promising one is virtual reality. Now, since virtual reality is a very broad topic and it is out of the scope of today's session to cover each and every aspect of it, so we'll be talking about it in brief and keeping it focused to our topic today. So, virtual reality uses computer technology to create a simulated environment. And unlike the traditional user interfaces, the virtual reality places the user inside an experience. So, in simple words, instead of seeing a video in a 2D on a screen, users are immersed and able to interact with the 3D worlds instead of just seeing it on a screen. So a computer-generated imagery and content, they aim at simulating a real presence through the senses like sight, hearing, or touch. This is mainly used in the fields of education, like for educational purposes, for science and research, medicine, for industrial design and architecture, and last but not the least for gaming and entertainment. So uses of VR. So VR is an attractive alternative to the live streaming with the use of some expensive instruments and sensitive technology. So VR is not only restricted to the gaming and the marketing, but has many uses beyond that, like for the use of commercial pilots, realistic cockpits with VR technology, and holistic training programs. So here they have experiences of virtual flights and live training. In the example of surgeons, they are trained with the virtual tools and patients, and they transfer these skills into an operating room. There have been studies showing that such type of doctors and their training, they develop their skills faster with the lesser chances of error. In police and soldiers, they conduct virtual raids that avoids putting lives at risk. And last but not least, psychologists, they treat mental illnesses such that by using the VR, they confront various challenges and phobias in a controlled environment and help people get over these. So VR is classified into many different sections and categories, but the three main that we would be looking for is the fully immersive, semi-immersive, and non-immersive. The fully immersive ones are the ones with the head-mounted displays, the headphones, and the gloves. You might have known or seen most of these. Now, these give the user the most realistic experience possible along with the visuals and the sound. These VR headsets, they provide high-resolution content with a wide field of view. Mainly, this type of VR is used for gaming, entertainment, and teaching purposes. Now, for example, considering a surgery like this, the user using this type of technology would be feeling that he is into the surgery and he is doing a virtual surgery. Second type is the semi-immersive simulations. Now, these provides the user with a partially virtual environment to interact with. For example, here, if you look at all these instruments in front of the pilot are the real ones, but these screens, they have a virtual screens. These are mainly used for educational and training purposes. This type of VR also gives a perception to the users of being in a different reality. However, to have this type of VR experience, physical environments needs to be created, like these cockpits. The third type is the non-immersive simulations. In this, the user is present in a physical space and is interacting with a virtual one. Mostly, this has an instrument or a device which helps the system to detect the user's motion and translate it to the screen. For example, some video games, or in this case, games like Wii Sports. So here, the baseball bat can be that instrument which helps to detect the motion and translate it to the screen. Moving on, along with other medical professionals like the surgeons, the anesthetists, or the nurses, VR is also an important part in the physiotherapy field. It has been used in various sections, like in musculoskeletal cases of lower back pain, frozen shoulder, neck pain, or TKR surgeries. VR would help to increase the range of motion, help with reduction of the pain, increasing the mobility. Coming on to the neurological field, VR is mainly used in the neurological field to a greater extent. In cases like stroke, Parkinson's disease, brain injury, or more. So mainly it helps to train the balance, improve the coordination for the upper limb function, improving the gait, as we can see in this picture here. Also in the pediatric fields, with the peds population facing the neurological or neurodevelopmental disorders or cerebral palsy, it has been used to motivate the children to improve their performance, to guide them. In the cardiorespiratory field, mainly it's used in post-surgery, post-CABG or valve replacement. As these patients are really very anxious, they have a lot of pain, call it the suture pain. Also because they are bedridden in the initial days, so VR can be used to help them with the muscle activations by staying in bed. This will help with the fatigue resistance and improving the tolerance. And also it's used in the sports field in cases of athletic injuries. Like it can be used in the warm-up period, it can be used to aid in the diagnosis, it can help calm the athlete before an event. It has a lot of uses. Furthermore, let's talk about what is preoperative anxiety. Now, anxiety is defined as the feeling of uneasiness, worry, fear, tension, and apprehension. The preoperative period often triggers an emotional, cognitive, or physiological response, especially for the people who are undergoing the surgery for the first time. This can be a very new experience and it's very bound that they get anxious. Now, some low level of anxiety can be expected in these types of patients, but when this goes to a severe extent, it needs to be managed. Now, preoperative periods is one of the most challenging and worrying periods for a patient, and it's a very expected reaction due to the unpredictable and potentially life-threatening circumstances, and as mentioned, especially if it's the patient's first surgery. Now, preoperative anxiety is often described as an uncomfortable, tense, or unpleasant mood before the surgery. And it is mainly because of the fear of unknown and the uncertainty about what's going to happen, how is it going to happen, will the surgery be successful, and it's very genuine. So according to the studies, large proportion of people undergo the preoperative anxiety, and it's nearly 60 to 80% of the surgical patients experience this. Now, why is it important to manage the preoperative anxiety? So when there's an increase in the preoperative anxiety, it affects the wound healing time. So there's a decrease in the wound healing and it's slower. Now there is increased doses of anesthetics because if the patient is too anxious, wouldn't be sedated properly, and hence the overall post-surgery recovery would take a lot of time. Preoperative anxiety has a lot of repercussions and can lead to post-operative complications as well, like pain. Pain is one of the most common complaint of the post-operative patients. Preoperative anxiety can lead to a number of problems like nausea, vomiting, tachycardia, hypertension, and an increased risk of infections such that if the patient is too worried or too stressed, it affects the immunity levels and hence is more susceptible to the risk of infection. Now we are in the preoperative pain. Researchers don't exactly have a theory how VR mitigates in the pain and how does it help to reduce the pain, but we would be talking about some of the possible explanations for it. So experts suspect that the VR distracts the people away from the acute pain they are experiencing. The most acceptable theory is the gate theory of attention. It postulates that the VR reduces the perception of pain by absorbing and diverting patients' attention away from the pain. Now, when people are engaged in an immersive experience, they begin to tune out other stimuli, including their body's pain signals. Thus, many VR experiences also include relaxation techniques like meditations, which is important to manage pain. So all this comes towards the principle of distraction. Evidence suggests that the VR can have an effect on decreasing pain by mechanisms other than distraction. So there was a study done evaluating children's tolerance for cold pressor pain by using VR, and it concluded that in the VR intervention group, the neurophysiological changes were seen and they were much better. The changes were increased pain threshold, increased pain tolerance, increased self-efficacy, that is the perceived ability to tolerate and decrease the pain post-intervention was noted better in the VR intervention group. Now we know that in order to manage severe pain, lots of analgesics are given, and these analgesics can have a side effect on the patient. So using VR to manage the pain is one of those non-pharmacological interventions which might help us to avoid these side effects. We are in preoperative anxiety for the adults. So preoperative anxiety is an emotional response to the potential challenge or threat to reality. And there has been various studies which have shown videos to patients on what to expect until the time of the surgery and an entire patient's journey through the whole hospital. So through the immersive 360-degree simulations, patients can experience this journey of being prepped up for the surgery, being transferred to the OR, and patients feel as if they're actually present in throughout all this weeks and days prior to even getting admitted for the surgery. The content which is shown in the VR differs from patient to patient and surgery to surgery. Like for example, for some really anxious patients, relaxing videos are shown to help them calm their anxiety. For some patients who are really inquisitive about knowing more about their surgery, and this in turn might help them reducing their anxiety as they would be well informed, then some parts of the surgery that they are going to undergo would be shown in parts of that virtual reality. Provision for such preoperative information can elevate patients' anxiety as discussed. VR in preoperative anxiety for pediatric patients is used as well. Children are shown cartoons or are given virtual tour of the operating theatre. And thus, various researchers have marked levels in these anxiety have reduced post this VR intervention. Something like this is shown to the pediatric patients in order to help them cope with their anxiety and to distract them. Now, relevance to physiotherapy. After understanding everything, we would think, how is this relevant to physiotherapy? So for us, if the patient has reduced anxiety and reduced pain, then his or her compliance to the treatment would be better. The treatment would be more effective if the patient is in a good mental state. It will help us prepare the patient before the surgery. Virtual reality also helps in a holistic approach. Like we can use that to educate the patient and we can use that to treat the patient as well. This helps to manage the biopsychosocial model of a patient. So the biological aspect will be taken care as well as the psychological aspect about the anxious state will also be managed by using VR. VR helps to improve the efficacy of treatment post-surgery. So if the patient is less anxious before the surgery, then the surgery goes well. The recovery period required for a less anxious patient is lesser as compared to the patient who is really very anxious and had delays in recovery. This is also very cost effective for the patient because if the patient is less anxious, then as we discussed earlier, that the patient uh, would have a lesser recovery period and hence it would be more cost effective. Coming to the concluding part, just like application of any other intervention, even the application of VR needs a careful consideration. In general, there are lots of do's and don'ts of VR, but we would be focusing on the contraindications and the precautions to be taken care in the preoperative period. Now, application of VR in the space-occupying lesions of the cervical spine. So now it might affect such that if the VR is given to these patients, then their head movements might damage the adjacent areas, and we don't want that. Other contraindications is pathological fracture of the spine, because of course you don't want to worsen the fracture, you want it to heal. Undiagnosed neurological signs and symptoms, facial lesions or the superficial lesions, and the face injuries, because it might be really very uncomfortable for the patient to wear the head mounted display, and it might be very painful as well. Any other condition where it is otherwise contraindicated to move the cervical region, anatomical structures actively or passively, we wouldn't give the VR. We wouldn't give it in the patients who have cognitive impairments as well, because if the patient cannot understand, if it is not very effective, then what's the use of giving it to the patients? And furthermore, what if some visuals which are shown might act like a trigger to the patient? We definitely don't want that. In people who have contagious or infectious conditions, we wouldn't give, because what if by wearing the head mounted display, it would be used by multiple people, so it might spread to multiple people. In people who have a history of vertigo and dizziness, because those visuals might aggravate their condition, and we definitely don't want that. In people who have visual impairments, because since they already have trouble seeing it without their specs, and if their spectacles are not adjusted in the VR device, then it wouldn't be that effective. In people who have a history of epilepsies or seizures, and last but not the least, in people who have severe organ dysfunction, or they are on breathing assistance, or they suffer from motion sickness, or they have a history of alcohol and substance abuse. So all these factors needs to be considered while giving the VR to a patient. And that's why we say that the patient's history is very important. These are some of the references that you can refer in order for your further reading. And thank you so much for listening. It has been a pleasure to share my knowledge with you all, and have a good day.